All right, here's our follow-up video on the mechanisms, classifications, basically the different types of injuries. We had gotten through the muscle strain and through the tendon injury or tendinopathy stuff. So we kind of continue with a different type of tissue, sprains, right? So not ST rain, but SP rain, and we're looking at joints, basically joint structures, the joint capsule and ligaments that hold joints together. You can see the mechanism is basically we're forcing it beyond what the joint is meant to go. So that's number one. But some torsion, some shearing, other things along those lines. We had the same or similar classification with first, second, third degree. You'll see the micro, partial, and complete tear is the same as the strain part, but here is where I want you to pay attention, is the stability part. Since we're talking joints, we talk stability, and so the first degree there's no instability, then we start to get some instability and complete instability as we go through there. I threw up a couple of pictures. I don't know if these are grade 1, grade, or first degree, second degree, but I threw up some what would seem to be kind of the severity as you get going. And then I have a couple of the pictures that I'll click through here. I should have put the Cowboys one recently. He just Tony Pollard just had a similar injury like this and fractured his femur. You can look at the signs and symptoms, write these down, make sure you have an idea of what these are. Definitely, you got the pop at the onset pain. Swelling is worse the next day. When I say possible neurologic symptoms, that's like numbness and tingling. That may be just, acute and then go away. If it doesn't go away, then we start to kind of worry about stuff like that. Another little ankle sprain going on right there. As we talk about treatment now, I'm going to put all this stuff up there, and you can write it down. If you need to pause the video and write it down, you can. Really, I'll talk a little bit more about neuromuscular control in class. You don't have to know that quiz-wise, but I'll talk a little about what those are. But definitely our normal rest ice compression elevation. This is where we do start to go, all right, do we need an x-ray? And then any kind of support and stabilization that we can. When we get into the prevention, we'll talk about taping and bracing as a way to prevent it. Does it actually do it or not? But ultimately, it's strengthening the joint, strengthening the tendons, and then neuromuscular control, which ends up being a lot of stability exercise and a lot of balance exercise that we go. All right, because we're at the joint, we have the joint injuries to joint capsules and ligaments. We also can dislocate a joint. And so the first most important thing that I'm going to draw your attention to here is make sure you know these terms. I want you to know a luxation, complete dislocation, and the subluxation, which is that partial. I won't ask you that specifically, but I will ask you what's the difference between what can happen with a luxation. You need to know what that is. So know that term. Here's the star or highlight point right here is this multiple pathology or multiple injuries that can happen when you dislocate a joint. Because there are muscles and ligaments that go around a joint, you can damage those, right? Because there's two bones that come together and create the joint, those two surfaces can be damaged, so it can fracture. And then there's usually some blood vessels and nerves that can be injured or stretched or even pinched if it pops right back in. The mechanism is all over the place, so I really don't, kind of hold you accountable for that, because there's about anything you can do can dislocate a joint. I do have some gross pictures. I'll click through these pretty quick on this video, so if you don't like them, just look away or fast forward. Couple more. This patella that's sticking out where it's not supposed to be, and I always like this one where the person's face down, his butt's here. This is a normal foot. This is a foot that should not be up. So that's got some issues. So our signs and symptoms, there is, the person will feel it, right? So there's definitely a deformity, loss of function. This is usually a pretty painful situation. The numbness and tingling may occur from nerve stretching. And then when I say vascular impairment, if you take a pulse beyond that joint, so if I dislocate my shoulder and then I take a pulse down at my hand, I may not have it, right? So that may be an emergent situation that we start doing. The treatment is basically refer them to a physician, if not the ER, right away. Splint it as it is. Try not to mess with it. The reduction is the putting it back in place. Sometimes it'll go back in place on its own, and sometimes athletic trainers will do that, but typically we don't suggest untrained individuals start messing with joints and putting it back into place. Definitely call a physician and get some care that way. This is the other important aspect right here, that if there is that neurologic or vascular impairment, so if we have numbness, tingling, no pulse, that's a 911, because they're not getting blood flow to that body part, and they could actually lose that body part. So we don't want that. The next injury is bursitis. The first thing you have to know about bursitis is what the heck a bursa is, and I got a couple pictures here for you to look at. Basically, around these joints, you have these little fluid-filled sacs, like a little water balloon, and it just decreases friction. So that's its whole job, is to decrease friction as your bones move. So if you get too much friction, you can get these inflamed. You can also have a direct blow and have an acute mechanism. So the friction is the chronic mechanism. The direct blow is that acute mechanism, that kind of stuff. The tight muscles as a contributing factor is mostly for the friction. If we have a super tight muscle right here and we're moving this over and over and over, then yeah, we might have some excess friction because these muscles are super, super tight. Same thing with this patella, this little one right there on top of the patella as we go. So signs and symptoms. This is a good picture of a acute where you rupture a bursa and you get this huge amount of fluid, and then it'll disperse out and be nice and squishy. That's kind of fun. The other one, the chronic version here, is it aches all the time, even when you are not doing anything. So that's kind of something that differentiates it between tendonitis, point tender. It is similar with the tendonitis or tendinopathy, that it's kind of bad in the morning, and then when you're at rest, and then once you get moving, it'll start to feel a little bit better. And you can write these other things down. This is a little bit after you get that bruising, after that fluid starts to disperse a little bit. Ultimately, if this is a chronic one, you're going to treat the cause. So I'll put all this kind of stuff up there. If we have, overuse or tight muscles or whatever that case is, we definitely modify the activity and try to do that. All right, moving on to the bones. Obviously, we've got some stress fractures, so our tissue is easy. The mechanism here is chronic overuse pounding, right? So some repetitive forces. The bones are not able to handle this, and so the bone starts going through this inflammation process to try to build more bone to handle it. And so you can see some of those. Contributing factors are really that overtraining, pounding, and basically too much too soon, not being used to the amount of stress that you're putting on that bone as we go through. Downhill running, footwear, you can see that. Weight gain will exacerbate the situation, definitely. Signs and symptoms is it hurts. Man, these are painful situations, and they hurt all the time. Probably a little bit worse at night when you've been up on it all day. You'll have some point tender. This is a key right here, so star this right there. The 15-day x-ray. So if you get an x-ray at day 9 and you've been having this bone pain for 9 days, it may not show, right? So you may not have, may not show up on an x-ray right away. And so you may need to wait about a couple weeks to see it start showing up. Here's the picture. You can see all these other bones have this nice firm edge, or this defined edge, and you have this little fuzzy area right there. That's where the inflammation is. That's where the bone is trying to be active and lay down new bone to handle whatever stress is being put on. This is a bone scan. You don't have to wait the 15 days for a bone scan. So you'll see this little area right here where it's supposed to be nothing, and right here it's something, which means there's a bunch of activity going on as we go. All right, so you can look at the prevention and rest and write those down as you need to. And then the same thing with the fractures. Don't worry about the page number. I left that on there. We don't have a book anymore. Open versus closed fracture, I think, is usually open is where it comes through the skin, and the closed fracture is within its contained Mechanism, there's a number of mechanisms. I'm not going to be too picky about those. You definitely hear the crack sound, the deformity, and here's these last two right here. Definitely pain on active movement, but pain if you compress the actual fracture site, dude, that's going to hurt. If you compress away from that, just down the bone, and it still hurts, then we should have some issues. So crepitus or joints in places where there shouldn't be a joint, that's kind of a key right there, key indicator that we want to do that. So our treatment is we're going to mobilize, right? We're going to, obviously x-ray to confirm, send them to a doctor, and immobilize. You do not have to know these guidelines. This is just FYI, just informational. In general, small bones are usually about that 4 to 6 weeks, and it kind of goes up from there. Medium bones would be, radius and ulna in your forearm. The large bones would be femur and tibia that take a little bit longer to make sure that they heal, especially because they're weight-bearing bones. All right, I got through there in 11 minutes. I do have some cool picks if you want to hang in there. If you don't like injury picks, then you can leave. But there it is. Look at the ankle, and comes and gets it on the base and then rolls around and shows everybody that, look at my ankle. This is not as bad, just a kind of a ruptured blood vessel up in here. Looks worse than it really is. And this next one's kind of bad. Again, a foot being turned the opposite way, or the way it shouldn't be. I do like this, the reaction of this other football player as he goes through. And then I guess a couple of awkward pictures to end the day. All right, you don't get to see my video on this lecture, so you had to be in class to see it.